Hi, it's Dr. Sosa again. I'm going to be talking in several different presentations about weight loss surgery, bariatric surgery, healthy diet, etc. Today, I'm going to start the conversation by answering the question, bariatric surgery. So I was at a seminar last night and a patient walked up before the seminar and goes, I want bariatric surgery. And I said, okay, well, which bariatric surgery? And the patient goes, well, the best bariatric surgery. So that's an interesting question. What is the best bariatric surgery? What is bariatric surgery? So basically, bariatric surgery is any one of different procedures that we do to increase significant weight loss. Now, there's a whole range for them. And for example, I'll talk about one that's pretty much not used anymore. So the lap band was used for a long time. We pretty much have abandoned it because it didn't have very good results and it had lots of complications. There are other very effective bariatric surgeries called duodenal switch or a big name, biliary pancreatic diversion. We don't really use those because although they're really good at lots of weight loss, they have a lot of nutritional problems, a lot of diarrhea, a lot of anemia and nutritional problems. So basically, we have two pretty common operations, the sleeve gastrectomy and the gastric bypass. So patients always go to me, well, which is the best? That's not the right question. The right question is, which is the best for me? And each operation has its own characteristics which make it optimal for a given patient. And so, although there are lots of fine details, I'll give you some overarching examples. For example, if a patient has type 2 diabetes and is using insulin, the gastric bypass is really good because of the sugar malabsorption in fixing diabetes, sending it into what we call remission, which is no medications and a normal HA1C. So if a diabetic patient walks up to me and says, which is the best operation? I go, for you, the best operation is the gastric bypass. Another example, the gastric bypass tends to be what we call progressive in weight loss. You don't just lose a set amount of weight. You usually lose a percentage of your excess weight. So if you're 200 pounds, you're going to lose less weight than if you're 300 pounds. You're going to lose less weight than if you're 500 pounds. It tends to be progressive. So it's a really good operation if you have to lose a lot of weight. If you're over 400 pounds, close to 500 pounds, really the gastric bypass is the best operation. On the other hand, if you're a fairly young active person who has to lose 70 or 80 pounds, the sleeve gastrectomy, that's what it loses, 70, 80 pounds. So it's going to leave you at your normal weight with less restrictions on what you can eat. Because the gastric bypass, because it causes malabsorption of sugars, has more restrictions. In other words, if you eat sugar with the gastric bypass, chocolate, desserts, you're not going to feel well. You're going to have what we call dumping. If you do that with the sleeve, you will not have those symptoms. Now, the sleeve doesn't cause as much weight loss as the gastric bypass. The sleeve is not a very good operation to get rid of diabetes, to get rid of high blood pressure, but it's a very good operation for 60, 70 pounds. And you really, in that range, don't need a gastric bypass, which is a higher magnitude surgery with more restrictions long-term as far as what you can eat, the supplements, the vitamins you have to take. So the question, what is the best operation? No good answer. The question, what is the best operation for me? Very good answer. Be very careful with bariatric programs or surgeons who tell you this is the best operation for everyone, because there is no such thing. If a center cannot offer you the sleeve, the gastric bypass, revisional, and they're only offering, for example, sleeve gastrectomy for everybody, well, that's not optimal. You have to match the operation to the patient, their medical problems, their overall weight, how much weight they need to lose. In the Sosa clinic, we very much match the surgery to the patient and give the patient the best surgery for them. Next topics will be coming up. We'll talk about other things related to weight loss surgery, bariatric surgery, and health. Thank you.